Well, welcome back to the When I Heard This podcast. My name is Nate Robinson. I'm here with Pastor Joseph Tillman, MDiv, soon to be Demon. How are you doing today, sir?
I'm good.
Perfect.
Yeah. I'm sorry I don't give you creative answers with that.
That's fine.
Yeah. Hey, I did just come back from vacation though, so I feel really, really good.
That's awesome.
Yeah.
Never mind. Go to Patreon, $5. Like, subscribe, share, comment, follow, download. You can follow the podcast on Facebook and Instagram at When I Heard This Podcast, and X and locals at When I Heard This. Tell everyone that you know about the show, and ring the notification bell, and website and t-shirts. Okay, so we've talked for 3 entire weeks so far,
right,
about all the therapy and the counseling and the stuff. But
right.
Now we're on to psychiatry.
Yes, sir.
So this is this week's episode.
Okay.
And yeah, I've had fun reading comments and stuff.
Yeah. I did have a licensed counselor reach out to us.
Yeah.
And they were actually very positive about the whole episode, all
good.
the episodes. So that's good.
Yeah, that's good.
You got one person that's on our side. Right.
Yeah.
Everybody else hates us. But
yes.
One person thinks we did a bang up job.
Right. I meant to ask you about that because I have some questions.
Nate, you always have questions.
Half of Facebook said I should be medicated, so I don't believe them.
Right.
I'm not going to do anything about it. But,
right.
But they said
it. So they must be right.
Yeah.
Well, we'll bring a counselor on maybe.
See,
and then let's see if she diagnoses you with something.
That's how
Can we
screwed
do that?
up.
Let's do that on air. That'd be
all right,
awesome.
Okay, that's how screwed up this country is with therapy and psychiatry. They think I need to be medicated.
Right.
Yeah.
Well,
they should stop throwing stones. Or what's the rocks in a glass house or whatever? Yeah, that's what I think.
That's what you think?
That's what I think of our listeners and our commenters.
Well, I think they're awesome.
Yeah, me neither. No, they're great.
Yeah.
And I'm not going on meds.
Okay. That's fine.
Although I could in 5 minutes.
Easy.
It'd be the easiest thing to do.
Yep.
Yeah.
You could be there, dude.
All right. Let's talk about some psychiatry.
Yes, sir.
Which is meds.
It's not just meds, but okay.
Yep, it's meds. All right. So, what is psychiatry?
All right. So, psychiatry, defined by the American Psychiatric Association, is the branch of medicine focused on the diagnosis, treatment, and prevention of mental, emotional, and behavioral disorders.
Okay.
So a psychiatrist, unlike a psychologist or counselor, therapist, is a medical doctor. So they have an MD or a DO, and they specialize in mental health, and which includes substance abuse, substance use disorders. So.
Okay.
Yep. So that's kind of your basic definitions.
I might have one of those.
You might have one of what? A mental, emotional, or behavioral disorder?
No, a substance disorder.
Oh, a substance use disorder.
It's not a disorder.
Okay.
But I consume substances.
Yeah?
Does that mean I need meds?
I don't know. I guess it depends on what kind of
thanks.
substance you're... Now I've got all kind of questions.
The substances are my meds. So I don't need meds.
Self-medication, Nate, is not always healthy.
Whatever, I can quit whenever I want.
You just choose not to. Yeah, right.
All right. What types of things does psychiatry address?
Okay, so they're dealing with such things like ADHD, anxiety, panic attacks that are, depression that continues, that just doesn't go away, PTSD, obsessive compulsive disorders, eating disorders, hallucinations, suicidal thoughts, gets into schizophrenia, bipolar disorders, even to the point of those that are hearing voices. So it's a pretty wide range there of things that they're dealing with.
And how is that different than therapists or psychologists?
It's really not different.
Okay.
In terms of who they're seeing. It's the manner in which the psychiatrist can go more in depth into the testing, into the therapy, and in prescribing the meds.
Okay, so how does psychiatry help people?
All right, so similar to psychologists, counselors, therapists. They're going to listen. They're going to talk with the patient. But then they're also, again, able to do testing and prescribe medications. And so they're helping patients face, the mental, emotional, behavioral disorders, and they're helping them to develop a plan, and they're helping to see them be able to walk out in life, in a more healthy manner. And developing that plan usually involves, again, you're talking, you're listening, you're finding out family history information.
Mm-hmm.
What is the issue that's going on with the individual? And then you may do, further testing, and then getting into, again, prescribing medications that are needed to help them face these challenges that they have.
So take an example like multiple personality disorder.
Mm-hmm.
How would you know by talking to somebody? Because you can't see that on a brain scan, right?
Right.
Okay, so how would you know by talking to somebody that they had that? How would you be? Because I don't think I've ever met anybody. I guess everyone's medicated and their second personality disappears, which doesn't make sense.
Right.
But how would you know if that's actually happening just by talking to somebody?
Yeah.
Instead of them just having different interests or whatever.
Right. I guess you talk about multiple personality disorders. I think you would be talking about individuals that you're having to counsel over a length of time to find that out. So I don't think that comes out in 1, 2, 3 sessions. And it may.
Okay.
I mean, it may, but I would think you're hearing. And I also wonder if family members don't get involved at that point. And because it's not just that they're counseling that individual, so they may bring in family members, and the family members may be able to say, hey, these are the things that we have seen. These are the things that we have noticed.
Or the family members are the ones that come to somebody and say, hey, this person has...
Correct. Because
this person is 3 people.
Right. Well, because I think a lot of times we think of our counseling as you're sitting one-on-one with somebody, and that is often the case. But also, psychiatrists, psychologists, they're going to be doing therapy with couples, with families, in groups. And so I think in those family settings, I think is probably where some of this information comes out and comes from.
Okay. How does someone become a licensed psychiatrist?
Yeah. So this is actually a pretty intense process. I mean, it takes from 12 to 14 years following high school.
Jeez.
Yeah. So it's a lot of schooling. So you don't go into being a psychiatrist just half-hearted or willy-nilly.
Maybe I'd believe a psychiatrist's diagnosis if they went that long. Like you said last time,
right?
Where it's like they have to go through too much if they're grifting.
Right.
That's a lot of stuff to go through to grift.
Yes.
12 to 14 years past high school.
Yeah.
Yeah.
Because you've got to complete medical school, right? Yeah. Because they're a medical doctor. You've got to pass a written exam to become licensed in that state to practice medicine. And then you've got to complete 4 years of psychiatry residency. So you'll be in emergency rooms, hospitals, and then an additional 2 years if you want to become like a child or adolescent psychiatrist. So it's a lot. And then after you complete your residency, psychiatrists most often take another exam given by the American Board of Psychiatry and Neurology to become a board certified psychiatrist. And so where they've got to be recertified every 10 years.
What board? What does that mean?
The American Board of Psychiatry.
Oh, okay.
Yeah. In neurology.
All right. Well, that's a lot.
Yeah. So it's quite an endeavor to become a licensed psychiatrist.
I mean, obviously I'm never going to go see one.
But you would feel better about them if you were.
But I would feel better about that if I had to.
Right.
Also, if they're medical doctors and can look at my brain.
Yep.
Also at the same time.
Right.
Then I'd feel a little better.
Yeah, and they can do that.
Yeah. Psychiatrists look at psychology of the brain and recommend drugs for people. How do they do this?
All right. So we're talking about looking at the physiology of the brain. To be honest with you, this is getting into territory that I'm not overly familiar with.
Right.
And so, obviously they're going to use things like MRIs, CT exams, to look at brain structure, look at the anatomy of the brain. But they're also going to use other exams to measure changes in like brain activity and brain function. So,
Okay.
And so these tests, along with psychotherapy and an understanding of the patient's family history, usually helps lead to a diagnosis and the development of a treatment plan, which can include medicine.
Okay. We got a problem now.
Okay.
All right. So therapists and psychologists and sometimes counselors.
Uh-huh.
Not really, right?
Well, it depends on how we're using, if we're using counselor and therapist,
Yeah. Okay. fine.
is synonymous.
Right. So they talk to people
Right?
and then say, hey, I think you should be on drugs.
Okay. You
And
need
then-
medicine.
Yes. And then they send that to a psychiatrist
They
/
can.
doctor
Mm-hmm.
and
Yeah.
right?
Yeah. Yeah.
And say, hey, my recommendation is these drugs.
Mm-hmm.
Okay. Psychiatrist gets the recommendation
Okay.
from somebody else.
Okay.
What happens next?
Yeah. So then the psychiatrist will accept that referral, or they choose to, right?
Okay.
They can accept that referral, but then they're going to do their own evaluation of the patient.
Okay.
So they're not just going to take just the referral for just, at face value.
So psychiatrists, a lot of the time,
Mm-hmm.
since therapy and counseling, I suppose, is cheaper than psychiatry.
Yeah, you're definitely
Then go
going to pay
into a
more.
psychiatrist.
Yes.
Okay. So most people are going to go see a therapist or a counselor,
Mm-hmm.
get recommended drugs, and then
Right.
psychiatrist or doctor is going to do their thing.
Right.
Okay. So
Yeah,
that's
and,
how. Yeah.
and it really depends on the way the whole thing is playing out, right?
Okay.
So, for example, I know a practice here that, or in our community, they're psychologists. Okay, so they're counselors, therapists, and they have someone. So it's a large group of them, large practice, and then they have a psychiatrist there.
Okay.
And so they will bring in that psychiatrist to work alongside with the counselor in working with specific patients, especially when you're starting to deal with, looking at the medical parts of looking at the brain, examining the brain, the brain functions and all that. And then they may be able to help go deeper into, more trauma therapy and that kind of stuff, where you've got someone that you are, without question, you're going to be paying more, right?
Right.
But they're going to be working with them. In other instances, you don't have that. So you don't have, like, the psychologist or the counselors may not have a psychiatrist that's part of their practice or that they always refer to, or those kind of things. And so when they make referrals or recommendations, that psychiatrist is really functioning really as a kind of an individual party at that point. And they're going to have to see the patient and do their own evaluation of that patient, because any medicine that they are prescribing, they're on the hook for, right?
Right. Okay.
So it's not that they don't trust a psychologist or the counselor therapist, but at the same time, they're the ones responsible for the medicine.
I wouldn't trust them.
And the patient's going to have to come back and see them if they're staying on medicine.
The psychiatrist.
The psychiatrist.
Okay.
Mm-hmm. Has to be seen on a regular basis, on whatever the basis the psychiatrist determines, to be able to see how well is the medicine working. Are there any negative side effects that are coming up because of it? Because they'll give X amount of refills, and then before that next refill comes up, they've got to come back and see the psychiatrist. So
there's more consequences for psychiatrists when it comes to drugs.
Absolutely. Yeah, because it's like it's like, like when you go to see your primary care physician and you've got high blood pressure or diabetes, and they're going to put you on some medicines, and then you've got to come back and do labs in a few months.
Yeah.
And then they want to see you to see how's the medicine working, how's it actually, that kind of thing. It'll be the same thing with a psychiatrist if you're having to stay on medicine for an extended period of time.
Okay.
Yeah. Where it gets a little interesting is psychologists can refer you back to your primary care physician. And the primary care physician can be the one to prescribe medicines.
Oh, so they can they can pass off the blame for any problems.
Well, not necessarily they're passing off the blame, but the psychologist needs either the primary care physician or the psychiatrist.
Oh, the psychologist.
Yeah, the psychologist.
Okay,
yeah.
Okay,
so primary care physician doctors will, if they're talking with the patient and they've got a good, enough understanding of the patient, they may go, yeah, we agree with the ADHD or with the anxiety or with the depression medications. But when it's getting a little bit beyond that, when you're starting to deal with things, like, antipsychotic medications and that kind of stuff, dealing with things like bipolar disorder or whatever, or multiple personalities, then at that point in time, the primary care physician may not feel comfortable prescribing those meds. Okay. And so that's where a psychiatrist would have to come into play.
Mental health medication usage is going up in the United States.
Correct.
And it's like going to therapy, like we talked last time, being able to say, I got diagnosed and the doctor put me on medication for anxiety or anything else you want.
Sure.
Has become like a get out of jail free card, or become like a cool thing to say. You know what I'm saying?
Yeah.
You agree with me?
I agree with that.
Okay. And it's like, I can, it's like I got my medical excuse to be an asshole type thing and all that. So why is that happening? And, and yeah, what's going on in society that's cool?
Yeah. I mean, it's definitely a problem. Right. And and as we mentioned in the past few episodes, there is a place for medications.
Yeah.
And there is a place, where, for people to, actually receive diagnosis for mental health disorders. And so, because some people do need medications for their issues, for whether that's for a lifetime or for a short period of time. But I mean, as you said, but others really do not need them at all.
Yeah. And there's people that part of this too is there's people who are like, I know this is happening to me. I'm going to go through doctors until I get one to prescribe me something and diagnose me. And I'm not going to stop until I'm diagnosed.
And that can happen.
Yeah.
Absolutely.
So what's going on?
Yeah. I mean, again, we're glad that this kind of stigma of mental health is not there,
yes.
Right? We're glad that people that genuinely have issues with anxiety or depression, whatever it may be, are getting help, right? We're grateful for that. But you're right. At the same time, the whole mental health industry has exploded. And it's interesting because, and especially coming out of COVID, right? It got pushed to just an nth degree. And there were people that genuinely had mental health moments or issues during COVID, right? Like that COVID actually contributed to. That's what I was looking for. Contributed to. And I mean, for me, that happened for me. So I'm not unsympathetic to this. I had never had a panic attack before in my life. And in May of 2020, when our state of Georgia said we were going to be locked back down for another month, dude, after the announcement was made that night, I felt like I was suffocating. For me, especially as an extrovert, as someone who likes to be around people, who gets his energy from people, to be just locked up. I mean, I don't necessarily, you're not locked up, but you understand what I'm saying. You're quarantined and you're just in your house all day. You're not going to work. Dude, I felt that was the first time I felt that was the first time I had a panic attack. So I get the fact that COVID contributed to mental health problems, right?
I met Courtney 3 months before lockdowns.
Really?
Yeah. And I was living by myself.
Wow.
So, yeah.
So that was tough.
I didn't know. Sometimes I think about it and I'm like, man, I wonder how that would have gone.
Oh, yeah.
Living by myself and. Yeah,
right.
Because all my work shut down too.
Okay.
All my filming stuff.
Yeah.
And, yeah.
Yeah. So it's real stuff.
And I would have had nothing to do.
Right.
And rent to pay.
Right. I mean, so it's a real thing, right? And so, and I remember the next day I was telling my wife about it, and she was like, okay, so Joseph, here's what we're going to do from now on. Yes, no one's there at your work, but you can go to work.
Oh, yeah.
You can go to the church. Yes, no one's going to be, but just go.
Mm-hmm.
And just to get out of the house.
God's there.
God is there.
Yeah.
That's right.
But he's also at home. So.
Right. Right. But just go, just get out. And she was like, are there young adults you could connect with, that you could meet with, that maybe they won't, because we had a young adult group. They were all hanging out anyway, whatever rules were there, we just didn't care. And so like they sat, like, so we, there's a couple of them, thank God for them. And I did start meeting with them regularly, like once a week. And they would come into the church, and they would sit like across the room from me.
Oh yeah,
and like at a table like all the way across the room. And so we were way more than the 6 feet, right? I mean, I'm on one end of the room, they're completely on the other end of the room, but it was just a way for me to interact with people.
Me and my friends breathed on each other more during COVID. We were like, screw this. That's misinformation, sir.
We're definitely getting pulled. All right. So my point on that is like, so I don't want to minimize the fact that people had, especially individuals that already had mental health issues, that it was exacerbated by COVID, or people who had never had them, like me, all of a sudden had something that come up. But like, for me, it was like, okay, this is what happened. How am I going to work through it? Like, and I was able to thankfully work through it with my family and my wife and figure this out. It's interesting. Like, I know someone who was on, who had been on anxiety medication, like before COVID, had gotten well, had come off of their anxiety medication, like a couple months or something before COVID happened. And COVID hits, and you think it would have triggered everything back up again, and then they were perfectly fine. And so it was like, they were good.
That's because they didn't have to be around people. They were the opposite of you.
Yeah, probably.
Yeah.
Yeah. And so, and so it just, anyways, so I am sympathetic, but my point also is that I think that because of the real mental health crisis that came into play, I think that the industry began to take advantage of that.
Oh, during COVID.
During COVID and post-COVID.
Okay.
And so where it became the norm for everyone to have mental health issues, or not everyone, but it became so norm for people to have mental health issues, and for them to quickly go, well, it's probably because of COVID or because of this. Here's some medicine, da-da-da. And I think we just did a lot of people a disservice by that, right? Like, so I love the way one counselor explained it. Like, to have a panic attack during COVID would have been perfectly normal. Like, that was a normal moment to have a panic attack. The issue is not that you had a panic attack during COVID. The issue is if you had a panic attack over something much smaller down the road.
Oh.
Right? Like,
COVID was pretty small, though. It was like microscopic.
Okay, well, you know what I mean. Big issue versus small issue.
Okay.
Right? And so they're like, sure, having a panic attack during COVID, that would have been normal. Okay?
Okay.
Having a panic attack, let's say after COVID over a very minimal issue, and you're still having panic attacks over this, okay, something else is going on at that point, right?
Okay.
And so I do think the industry, and I don't mean people just, and I don't mean every counselor out there by any means is taking advantage of the situation, but I do think there are counselors there that are, and unfortunately, I think along with their doctors, medicine just started getting handed out pretty quickly for things like anxiety
during COVID,
depression, and have remained,
because it was
that's remained.
This makes sense. Here you go.
Yeah, and and I think you get. I mean, and like these medicines do, like they're chemically altering things in you, right?
Yeah.
So they make you feel a certain way.
Right. I'm not going to take them.
Right. And some people are like, nope, don't want to feel that way, right?
Right.
Others are like, oh yeah, I want to feel that way.
Yeah.
And what's interesting, like, and I was on So I was on this pain med when I had pancreatitis, but the pain med used to be used to treat people with mental health issues.
Oh.
But then they found one of the side effects was it also helped with pain. So then they started using it to prescribe for people like who were having chronic pain. And so what it actually did for me was it tanked me emotionally. And so I think that, I mean, all I'm saying is these drugs have side effects. So if you get a medicine that tanks you emotionally, then the other response would be go get another medicine, a stimulant to bring you back up. Right. And so all of this stuff starts, then you're starting to stack medications on top of each other. Okay. And then you take one medication for this. Now I can't sleep. Here's a medication for the fact that you can't sleep because of that medication. And I think that is,
I'm awake too much.
Right. So that's part of the problem. And, we start giving medicine to people because of the side effects of the original medicine they were on.
I ain't going to get started.
Yeah.
No medicines for me.
Yeah. And I think if people can go through counseling and therapy and work through what's going on without the use of medication, I think it's great. I know some people that need to be on the medication initially, but the goal is, like, as I've said before, the goal is not to stay on that medication. The goal is to come off of it unless there's a genuine, chemical imbalance.
Yeah.
That person needs to be on medicine because their brain is not producing enough chemicals for their body to be okay.
But but like from the person's perspective, what do you think is going on? Like,
yeah, I see what you're saying.
You know what I'm saying? Like not.
Yeah, I agree with you when you said earlier.
Yeah,
I do think that there's a sense of, man, something's going on. Let me go figure out what that is. Yeah. Get diagnosed with it. Okay, that explains what's going on. But now it also is explained not only what I'm feeling, but I think it can, as you said, begin to excuse behaviors,
right,
and excuse actions.
So why do you think people are doing that? Like, what's the alternative route to that?
Yeah,
from a Jesus man guy person perspective.
Yeah, well, from a pastor perspective, right? And we've talked this before in the last couple episodes. The pastor perspective for me is, hey, let's get into discipleship groups. Let's get discipled. Let's grow in the Lord. Let's grow in the Word. Let's discover our identity in Christ, discover who He is, find peace and find joy in the Holy Spirit, in Christ. Like, that's, for me, that's like most people probably just need to be in discipleship, because the reality is we are broken people living in a broken world, or a fallen people living in a fallen world. And so there are things that are broken, fallen in our own bodies, including our emotions. And so, but not every emotion that in my brokenness do I need to go run and get medication for. Yes, there absolutely are times where I need medication for something. Okay. Like people do. Like, I'm not denying that, but I think that if I'm in discipleship and I'm growing in Christ and finding my identity in Christ, peace and joy can be found there. And so again, it gets dicey for me, because I know there are people who genuinely are pursuing Jesus who have had to take medicine because of anxiety or depression. They genuinely needed it, whether for a moment or because of a chemical imbalance. But I think getting back to what you're trying to get to is, what's the person's mindset?
Yeah.
And I think in some ways that is I want to feel okay. And so this is if the medicine helps me feel okay, then good. What I'm saying is, you may need that medicine initially, but man, don't stay there. Do the hard work of figuring out what's going on, go through the therapy well, and get to the root of this, so you don't have to stay on that medication for a lifetime.
Yeah. Okay.
And so, but I do think I think there are some people that want to have a label put on them so that it does excuse their behaviors. It does give them an out when they feel a certain way. Okay. And the reality is, all of us feel anxious at times.
It feels like the same thing as like my astrological sign. I'm like, you might as well have 12 months of mental disorders or whatever.
Yeah, I know. I mean, because all of us,
same thing.
Yeah, I mean, all of us feel down at times.
Yeah,
all of us feel anxious at times. All of us have moments of kind of those squirrel moments, right? And so it doesn't mean that we have ADHD or that we need to be on medicine for anxiety or depression. Again, although I know people that genuinely do need that medication, and maybe that's part of the problem, is because everybody wants to be on something or labeled as something or find a reason for something. And I guess what I'm saying is, in trying to find that reason for something, could the reason just be that we're broken?
Yeah.
We need wholeness. Wholeness is found in Christ, and Christ can lend to this wholeness. Mm-hmm. And yes, God uses counselors to walk that along with us and help us in that. And so I'm not dismissing. So I always feel like I'm kind of balancing this with saying it's not just one way, but I think if you're just wanting to find, oh, that's the reason I'm X, Y, Z way, and then that excuses me for whatever going forward, I think that's problematic. Because even when I take medication to fix those things, now I don't want to say now I want to be able to say now I don't have an excuse for it. Right?
Right.
Because I'm on medicine for it.
Yeah.
So I should be able to be okay.
When I get sick, I don't walk around being like, I'm on Tylenol. Like, I just don't get it.
Right.
It's the only thing that society does that for.
Yeah. And yeah, I agree.
I'm going to chemo. Look at me. You know what I'm saying?
Yeah, no one's doing that.
No one's doing that.
Right. Yeah.
It's stupid. I don't get it.
Yeah, I do think we are, as a whole, we are an over-medicated society.
Yep. I don't even take medicine when I get a cold.
Yeah, you just forget it.
I don't do it.
Yeah.
If I get a fever, I'm not going to take medicine. I don't take it.
What's interesting is like when I get colds and stuff, I don't take medicine either.
The only medicine I take is antibiotics.
Yeah. I don't
because you have to take those, otherwise you die.
Well, and like if I'm running a fever, I may take medicine, but like when I get colds, I don't. But some of that's because that medicine makes me feel like crap.
I just don't.
I hate it.
I don't like the way it tastes.
Yeah. Now, if I get because I do have or I used to. I don't really much anymore as much, but I used to have migraines, and so I would take medicine for the migraines. Yeah. And I still get headaches that I can feel they're pushing that envelope of a migraine, and so I'll go take a prescription Motrin.
Yeah. So like that fizzy water crap.
Yeah.
Ugh, I'm not taking that. I'd rather feel like crap. I've never drinking this.
I've never drank that stuff in my life. Ugh. Yeah. Well, the only time I drank anything close to that was I was in Guatemala and I got some parasite that was making me sick as a dog. Oh. And they have this concoction that they give you. And you don't ask what it is. They just put stuff in there. And it kills said parasite, but it will you vomit pretty. Yeah, it's like a one-time deal of.
What was this? Oh, it was donkey semen.
Right. But then after that, you're like, I'm good.
Yeah,
and so killed the parasite. I'm all right.
Great.
Yeah, so that's the only time I'm drinking some kind of weird kind of concoction thing. But
what a horrible place to drink something weird. I mean, what a wonderful place that God made.
gotta kill the parasite, dude. So, yeah.
Yeah, okay. So the argument that God made me this way, why do we need to do any of this stuff to change it?
Okay.
Does that make sense? Because there's people out there that have that argument.
Right.
And they're completely against all the drugs.
Right.
And if God made you with 8 personalities, that's just you, and you should love the way God made you.
Yeah.
When it comes in this area, where is broken and this is off normal from what God would wish for us.
Right.
Versus this is how God made me.
Right.
Because we could have this discussion with other things.
100%.
Do you know what I'm saying?
100%.
You know what I'm talking about?
Yeah. Yeah, 100%.
So where do we figure that out on this line when it comes to Jesus and evil and whatever?
I gotcha. Yeah. No question. So no question that yes, we are in our broken world, people can even be born, right, with conditions.
Right.
Or maybe they develop later on in life, whatever it may be. And so I think that if you've got an individual that's dealing with like, and like some things are obvious, right? Like if you're dealing with PTSD, that came because of an event that happened that triggered it, right?
Right.
So kind of removing kind of those things out of the equation that were obviously, a depression or an anxiety or something that was triggered by an event, a moment. Okay. If we remove those things out and you're like, I just don't know why I'm depressed, or I don't know why I'm anxious, or kind of taking it a little further to the extreme of, I don't know why I'm bipolar, or that I have multiple personality disorder, or whatever it may be, then I think that like on those extremes, it's like, there's, again, all of that is involved in the brokenness of this world and the brokenness in our own bodies. The fact that we are not whole, and we will not be whole until we are, seeing Jesus face to face, and glorified bodies that no longer have sickness and sin built into them. Okay. And so I think that, there is that line of going, okay, but we want to see people be transformed or conformed as much as they can be to the likeness of Christ. We know that, like a severe bipolar disorder or a multiple personality disorder, like you mentioned, that those things are obviously evidence of brokenness. So we want to see people made whole. I don't think we just check that off going, well, that's just who they are. I don't think even the most extreme people would say that. Now, I do think what you would find in extreme Christian circles with people like that is going, oh, that must be demonic. We need to cast the demon out.
I didn't ask you that question.
Yeah. And so yeah, and that it could.
There were so many things that I forgot to ask in these episodes. Like half these questions weren't in the notes.
Right. And so
much more going on.
Yeah, but like the demonic thing, for example.
Yeah.
Like I believe in the demonic. I have seen demonic impact people. I have seen people be demonized, and it really genuinely impact
How do you know
who they are, their personalities, and those kind of things.
So you think some of my personalities are demons?
Nate, I didn't say you had multiple personalities, so you're okay. And so I think that...
But I did, so it's true.
Right. You're claiming your own truth?
Yes.
Yes, okay. Well, good for you. All right. But I think that with
my demons are leaving.
Well, I hope the demons are leaving. Yeah. All right. But I would say that for individuals, like maybe some extreme, like kind of, Christians may go, well, that's just demonic. We just need to cast the demon out. Well, that may be the case. Or it may be that that individual genuinely needs
drugs,
medication. Yeah. Right. And so that something is just off in the wiring of their brain.
Okay. So how can you as a Christian determine whether we're dealing with real demons, since you've seen them before?
Sure.
Or that is medically sound multiple personality disorder.
Right. No, I think that can be challenging from just the outside in, like on a quick glance. Okay. So I do think when you spend time with people and you're able to work with people, you're able to find out, and I've had this question with, like, when I'm been praying with people and talking with people, and I'm thinking, all right, is this demonic, or is this person really need to go see a psychiatrist? Like I've had that dilemma in my own mind before when talking with people.
Okay.
And there are times like when you pray and you're asking God for discernment and you're praying for people and they get delivered and they really get healed. And it's huge. And it changes everything.
So it's like, do I need to go on this medication, or do I need to do 10 Hail Marys?
Yeah. Well,
deal with it that way.
Yeah. Or whether it's 10 Hail Marys or
an
demonic
exorcism.
Right.
Okay.
And I think that, and I do think that there are times where people need deliverance. That is actually what's going on.
Okay.
And then I think there are other times where it's not just that. It's not that. It's that, man, there's something that's going on in their brain that's not okay, and that they actually need medicine.
So go see an exorcist first.
Could be the answer.
And then see what's left. And then go to psychiatrist. Is that what you're saying?
Not a bad option. Well, I mean, no. I mean, I think that there can be. I think at times it can be a both and situation.
Okay.
Where there are individuals that legitimately have got, chemical things going on, but it's caused them to behave in such a way that it's opened up doors to demonic influence.
Okay.
And so I don't think it's necessarily one or the other. I think it can be a both and that there are people who go through, deliverance, receive some healing, and they genuinely receive some healing, but there's further healing to have after that.
Okay.
Like, so, demons are dealt with, demonic oppression is dealt with, and now it's, all right, now discipleship in the form of counseling can take place, and that, yes, that may still involve medication, or it may not.
Okay.
And so I think that all of that can work together, and I don't think for any of these things that it's just like cut and dry. I think when you're talking about mental health issues, I think it's going, and I think it's going way beyond just a cut and dry cookie cutter answer.
Are my opinions wrong on all this?
Are your opinions wrong on all of this? Yeah. Your opinion that it's all just a bunch of BS?
Yeah.
I think that's wrong.
Okay.
I think that there's people that legitimately need. I think you even acknowledge that now.
So this is the end of all the mental health episode questions. So now I'm gonna basically we're gonna cap it up. Okay. And I'm gonna see where I'm supposed to be.
All right.
Even though I have strong, yeah. Even it's not gonna change anything, but.
But yeah. I think you acknowledge the fact that there are people that need medication.
Yes.
And I think you acknowledge the fact there are people that genuinely need therapy.
You want to know what I think?
Okay.
I just think that everything that we've talked about should be, whatever you're going to do, that should be the last thing that you look into.
Okay.
I think the last thing I'm going to look into is sitting down with a counselor, and the absolute last thing I'm going to look into is going on any type of medicine.
Okay.
And I think the main thing that bothers me is that it seems like society is moving the other direction where we should go this route first.
Right. But you're not, and to be clear, because I think there can be distinctions made, right? Like between, like, for example, if an individual, because there are groups like AA, NA, Grief Share, we're saying all those are legitimate, right?
I'm saying they're legitimate, but I would still have those as a last resort to anything that I was dealing with.
Okay.
Does that make sense?
Yeah.
Yeah.
And I think maybe that's where I would differ with you.
Okay.
Right? Because I think for some people that, if they're trying to overcome an addiction, that AA, NA, SA, they all like that is the way in which they're going to do that on a practical level.
Yeah.
And so people that are dealing with like really deep grief that they just cannot move past, or they feel they just cannot process, they're numbed by, I think things like grief shares are awesome.
Okay.
And so I guess I would say I think those things all have legitimate places. And then I would say, of course, as a pastor, I'm speaking about those things in conjunction with discipleship,
right,
being part of the church family, being in community. And then I really do think that going and seeing a counselor, if you're sitting here and someone's saying, I'm having repeated panic attacks, I just cannot move past having panic attacks. You need to go see somebody, would be my counsel. If you're having depression that you just like, it is affecting almost every area of your life, if not every area of your life, and you're just having a hard time just functioning in life because of it, and it's just going and going and going, go see someone. Like, so those are the things that I'm probably a little more, we have counselors and therapists and psychologists and psychiatrists for a reason. Mm-hmm. Go see them. But do I also think that too many people are probably getting caught up into all of this? Yes.
Okay.
So I guess I'm probably a little more nuanced, where you're like, it's just all either BS or absolute last resort.
I mean, that's how I think about it.
Yeah, I know. It's so I'm definitely having a more nuanced approach.
Yeah.
And I'm definitely more open to it. And I guess some of that's because like even as a
Well, you do it.
I was going to say, even as a biblical counselor, people come and see me and talk with me about things. Imagine a counseling session with someone the other day, and what came out of that was, hey, let's work on communication and conflict resolution, right? Mm-hmm. So I might do just a few sessions with them in this.
No, F you.
Right. And that would be your response. And so like, let's do a few sessions on communication and conflict resolution, and they'll probably be great with it. Mm-hmm. Right. And so, and I guess I see all of that as a pastor. I can see all of that as just discipleship, becoming more like Christ, those kind of things.
Yeah. And I know there's people out there that are like, well, you doing church and hanging out with a pastor, that's my last resort. Or like,
right.
that's the, if sure. all else fails, I'll
dawn the doors of a church. Yeah.
I'll come all the way back down and do this stupid church thing. And,
right.
Yeah.
Right.
And so whatever, we just have our own
ways.
You can go once a week to your therapist, and I'll go once every once in a while to my church.
Right. Yeah. And yeah, so you're right though that people have different ways of coping and handling things in life. And all I'm saying is I do think there's a legitimate way of handling it that it can involve, mental health professionals. But I do worry, as you say, that too many people are seeing counselors that are, and counselors validating being a victim, or that you are a victim in a moment in time is fine, but to live as a victim. Yeah. Counselors that are advising people to just cut off everyone that is deemed unsafe, whatever this unsafe word is.
Republicans.
Cut off all Republicans. And so that concerns me. Mm-hmm. Counselors that say your religion is actually a hindrance to you being well. That concerns me. The number of counselors that over-medicate, that concerns me. And so I genuinely have concerns in this area. But then again, not only do I do it, I know licensed counselors who do therapy and counseling really well. And I believe they're a gift to the body of Christ and a gift to this world in their callings. So,
well, that's that.
Yep. So glad you're open now to going to see a counselor.
I'm
at some point.
Yeah. I'll go see a counselor 5 minutes before I end it all.
Well, that's at least you're there.
Yeah.
5 minutes.
But
beforehand.
until then, I mean, I end it all, not like life's take.
Right. I understand.
Yeah.
I understand
because that stuff makes sense. You're gonna. Shit happens. You know what I mean?
Yeah, stuff does happen.
Yeah.
Yep. Find healthy ways of handling it and processing it.
Absolutely.
Yes. Call me first.
No, I'm going to go on a blog that says, hey, take whatever a proxywoxaploxetin, go on that 8 times a day.
Right.
Yeah.
Right.
No thanks.
And isn't that part of the concern too?
What?
The number of kids that are on medicine that really is affecting them.
Yeah.
I mean, it's bothersome to me.
Me too.
I mean, very concerning to me.
Yeah, because they can't fight for themselves and they don't have my opinions.
Right. And
they're
their brains aren't fully developed yet.
No.
And we're injecting medication into those brains
at
really early ages at times.
Yep.
That really concerns me.
Mm-hmm.
So yeah, when we start talking about the kids, I start getting probably a lot more hyperprotective at that point.
Yeah. I'm going to end the episode now.
Sounds good.
Well, this has been the When I Heard This podcast. You can follow the podcast on Facebook and Instagram at When I Heard This podcast and X and locals at When I Heard This. Go to Patreon, $5, like, subscribe, share, comment, follow, download. You can follow, ring the notification bell and the website and tell everyone that you know about the show.
Well, that was terrible.
Whatever. I'll go see a counselor.
Uh,
I entered the show pad. Put me on all the medicine. I need a diagnosis so Joseph doesn't think I'm an idiot. Anyway, just had to throw that last little one in there.
I'm keeping my mouth shut.
Yeah. So it goes. You can follow me on Facebook and Instagram, even though I know you don't want to, on Instagram at Nate Robinsoff, and you can follow Joseph on Instagram at
Rev Joe T.
This has been the Winner of This podcast, and we see you guys next time.
Bye.